Hi, good morning Yannick. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 21st of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Yannick Lee.
And what is your candidate number?
My candidate number is 151671615.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you ensure you remain up to date on advances in nursing?
I use several approaches to remain up to date. Along with continuing education courses, I subscribe to several industry publications to learn more about what's on the horizon. I also follow thought leaders on social media, giving me additional insights, and converse with my network regularly to find out about their discoveries.
Would you say you're a team player?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivation, and am equally comfortable working alone.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain, or feeling miserable, and knowing there's nothing you can do to help, is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
I find the best way to handle the stress of the job is through meticulous organization and attention to detail. By making lists and prioritizing what needs to get done throughout my day, I find that tasks, which might seem overwhelming all at once, are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to get done when unexpected situations arise.
Why are you leaving your current position?
While my last job was an opportunity for me to learn and grow at a comfortable pace in a smaller clinical environment, I'm looking for new challenges and opportunities to continue to expand my knowledge in a larger, hospital-based environment. I am eager to try new things and learn skill sets that come from working in a faster-paced environment.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Hello, good morning Mihiraa. I'm Nurse Yannick Lee, and I'm here to take your clinical observations. How are you feeling today?
I'm getting well, and do not have any trouble with my hip replacement surgery. I am recovering well. Currently, I am feeling okay, except for these blisters on my lip. It's so annoying and painful.
I'm sorry to hear that. Your blisters seem to be cold sores. A cold sore is a small, fluid-filled blister that usually appears on your lip or around your mouth. It is caused by a common virus called herpes simplex type 1. Don't worry, it is not a serious condition, but it can be uncomfortable and contagious. Well, could you tell me in detail about the blisters, as you know?
Yes, sure. It started yesterday. I don't know why it came back. I haven't had one in years.
Oh, I see. Do you have any other concerns or questions about your cold sore?
Well, yes. I'm worried that I got it from the hospital.
I understand your concerns. Let me explain a few things about cold sores. It's very common and many people have it without knowing it. It usually stays dormant in your nerve cells, but sometimes it can reactivate and cause blisters on your lips or mouth.
So, you were saying I already had this virus before? How did I get it?
You could have gotten it from someone who had a cold sore or who carried the virus without symptoms. It can be spread by kissing, sharing utensils, or touching the infected area. You may have gotten it when you were a child or an adult. It's hard to tell when or how you got it, because it can stay hidden for a long time.
But why did it come back now? Is it because of the surgery?
Your thoughts are natural. It's possible that the surgery or the anesthesia stressed your body and weakened your immune system, which made the virus more active. Other factors that can trigger cold sores include sun exposure, hormonal changes, illness, or injury. It's not your fault, or anyone else's fault, that you have a cold sore. It's just an unfortunate coincidence that it happened after your surgery.
I see. But what can I do about it? It hurts, and it looks ugly.
I understand how difficult it might be for you. Mihiraa, there are some things you can do to ease the pain and speed up the healing process. You can apply ice or a cold compress to the sore, or use an over-the-counter cream or ointment that contains an antiviral ingredient. These can help reduce the duration and severity of the outbreak if you use them early enough. You can also take painkillers, such as paracetamol or ibuprofen, if needed.
Okay, thank you for that advice. But, will it go away completely, or will it scar my lip?
Mihiraa, usually cold sores heal on their own, within 7 to 10 days, without leaving any scars. However, they can recur at any time, especially when your immune system is low, or when you're exposed to triggers. Sorry to say, but the fact is that there is no cure for cold sore, but you can prevent future outbreaks by avoiding stress, protecting your lips from sunburn, and keeping them moisturized.
Alright, I got it. Will it spread to other parts of my body?
Yes, your question is valid. You should also avoid touching or picking at the sore, as this can delay healing and increase the risk of infection or spreading the virus to other areas of your body or to other people.
I see. Thank you for explaining everything to me. You've been very helpful and kind.
You're very welcome. I'm glad I could help you understand your condition better. Do you have any other questions or concerns about your cold sore, or anything else?
No, not right now. Thank you again for everything.
Thank you too for being cooperative and patient with me. I hope you feel better soon. If you don't mind, I'd like to start your clinical observations. Is that okay with you?
Yes, of course. Go ahead.
Thank you. Let me check your temperature, blood pressure, pulse, and oxygen saturation.
All right. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.